Quality assurance in nursing or quality assurance in a healthcare agency. What is called quality? Quality is called the degree of excellence. Let us see one small introduction. If you see, you are having a cup of coffee. Today we will see about what is quality in a cup of coffee. If you take a cup of coffee, you buy it from the street vendor, the coffee price is only 15 rupees. Same way, you buy the same coffee in the five-star hotel or the airport with the air hostess or in the plane, anywhere you get it, it is really cost about 250 rupees. What is the difference? The difference is called the quality. They will tell to make the quality, make the coffee in a five-star hotel, it is a vast difference between there, 15 rupees to the 250 rupees. If you take a five-star hotel or the hi-fi hotels, what they are doing, they have some input, some criteria for making a coffee. They have an excellent number one coffee machine. The person who is working will be the highly qualified. He will know with this the utmost standardized product has been used, and there is a predetermined criteria and standards being followed. One cup of coffee is 150 ml. How much ml will be the hot water, which degree, and how much ml of the milk has to be added and which temperature. Is it a processed or non-processed milk or condensed milk? And the sugar, what is the quality of the sugar? Is it a sugar with the sugar or without sugar, according to the client? And the preparation, the preparing man will wear all the equipments, like he will cover his head, he will cover his gloves, and whatever the chef will be wearing, that his body parts will never touch in any of the coffee or anything, which is highly, he might be a vaccinated guy and highly educated, depending on the education, depending on the quality, how he has to prepare the food products, whatever it may be, catering or something, he might be qualified. Then the coffee, that's the input, the process, preparation, the person and the material, everything in a correct way it is being prepared, and the service. When you are giving the service with this, you will be giving, there is a excess sugar will be given, and with a good smile and with a correct degree of temperature it has been given. Even if you want a parcel coffee, see, they use it in such a manner that it will in a correct heat, the heat will not go like that. Same way, this the quality is there. Same way, when you go to the street vendor, when they are selling a coffee, it doesn't have any mannerism or anything. It is, they do not know how they are preparing it. They are vaccinated. No, they may not vaccinated. Their fingers may be this maybe inside. If they give you a cup of water to you, so what will happen if at all this vendor is not maintain the proper hygiene in his nail buds? Maybe the millions or the thousands of the eggs may be there. So these eggs will be the helmintic infections it may cause. The person may be affected or any contagious disease may be transmitted. If the parcel coffee, the very poor quality polythene bag, they may pack and give. Every day the person is eating from the particular 1 or 2 days, it will not go into give it cost. So because the way I am telling is, you may ask me, then healthcare is so costly. The healthcare is so costly because the quality is a costly, or the quality means is it costly? No, in that way, if you take every day you follow this one in a low quality polythene bag, you are drinking with a low quality this one. This polythene will be some emitting and it may end up with a cancer. The healthcare cost is going to be very high. When you admit in the healthcare cost is going to high. So there is a difference between, in one cup of coffee, there is a quality. We are speaking about it. Same way, in a healthcare industry, also we are going to see how the healthcare has been maintained throughout. That is the process, like an input, what is the structure, whom you are recruiting, how the people are there, what is the equipment, how much the circulatory area, how it is been the equipment's high quality, is it acceptable standard, and what is this process, how are you, the quality of the care, everything, all the procedure in a correct time, waiting time, patients waiting time, All the diagnostic methods accurate one, not beating on the bush and making the patient to confuse and and correct at appropriate proper time is a perfect diagnosis is being made, and the patient's output will be product. Of course, patient satisfaction, reduce of nosocomial infections and reduce of other infections, patients fall MRSA positive, all these things going to be reduced. So today's class we are going to see about what is called quality. What is called quality assurance in nursing. So as we told you, quality means it's a degree of excellence. The quality assurance is make sure that the service provided by the hospital is the best as possible given the existing resources which is available with the current medical knowledge. It's not be old or something. So it is a quality means it is like a systematic process that ensure the product of service and the process of the service which meet the established quality standards. So the quality standards are being predetermined and established. So this class we are going to see who is determining, what are all the agencies. Before that, let us see what is the objectives of quality assurance. So the quality assurance to ensure the delivery of a quality healthcare services to the patients, to demonstrate the efforts to provide the good results output, to formulate the best nursing care plan, to evaluate the achievements of the nursing care, and to provide the cost effective care. Why we are talking about the cost and cost? Because the healthcare industry has to answer the not only to the patients, not only to the relatives, it is also has to answer to the third party payer. So the most of the patients, the third party payers are the insurance companies. So the insurance companies will be asking question, why are you making this surgery this much bill? You have to be answerable. So that's what with a cost effective care also you have to give with the high quality care. Let us see the principles of quality assurance. Must have a good leadership, because the leadership, the quality is not by the individual responsibility. It is institutional and every individual who is working in the organization. So the leader is the person who can influence everybody. Vision and mission will be translated to each and every part of the employees in the hospital. So you must, the best principle, the first and principle foremost is the good leadership. Then manager need to be committed to the quality management, and all employee must be involved in it, and it should be customer focus, that is my satisfaction of the patients, and decision making based on the facts. What is the facts? Evidence based. Evidence based means it is like a research based, the system approach to the management. So we have to remember, as a leader, as every individual staff nurse must know that what is the main principles of quality assurance. Before going to the approaches of quality assurance, let us see the process of quality assurance. First, we have to establish the standards criteria. The standardized criteria, who will be giving? If you want to get this quality accreditation certificate, maybe JCA or NABH or anyone, you can follow the standardized criteria. Identify the information relevant to the criteria, and then determine the ways to collect the information. How you are going to collect the information? Are you following or not checklist or anything? Collect the information and analyze the information and compare the collected information with the standardized information, and you can come to the conclusion we are near to the quality assurance, or we are very far from the quality assurance, or really we are doing the quality approachable care to the individual. Okay, so these are all the principles and process you are following. What is the approaches of quality assurance? How you have to approach? It is like a individual approach, or the general approach, or the specific approach, or the individual approach, or the institutional approach. You can write as you like it. But generally, what is the approach? First is called credentialing. What is called credentialing? Credentialing is, if you take a person, or credentialing, there's a formal, credentialing means it's a formal recognition of the professionals by the technical competence which is being attained by the individual with the maximum standards. So credentialing, one person you take it, he has to get studied from the good INC recruited colleges. Are you understanding? Licensure. What is called license? License is a written regulations. It defines the scope and limit of the practice. How long you can. If you limit is over, you have to renew your license, update your knowledge, fulfill the criteria. Maybe currently what they are doing, Tamil Nadu Nursing Council, you have to update your CPR new knowledge and get the accreditation points. So these points will be there, then only your license will be renewed every 5 years. Then will be accreditation. So what is accreditation? It's like accredited hospital, or it's a governmental or non-governmental organizations are coming forward and giving some accreditation, like they will you are doing a standard is very good, excellence with our criteria. I am a JC accreditation committee. They come and evaluate and give you the certificate. Okay, this is for the institution. This is credentialing also, both individual and institution. In a license for the individual, and as well as the license to build the hospital in particular place, criteria filling. Hospital also will have a license to build. Then certification is very important. Every individual and institution have great certification. Certification is nothing but it is like a person's educational achievements has been given performance on the basis of conduct of examination, ASCII. They will then once you finish or complete the determined qualified educational status, they are going to provide you certificate. Then recognition. So either the person studied is a recognized institution also should be there. Recognition is very important. Okay. So then these are all maybe the individual approach, and the institutional approach also. Institution has to recruit. The person is having not a duplicate license or good certificate. Is INC approved college. He studied with the qualified standards. He has to check the certificate to the appointment to his hospital in order to maintain the quality of his hospital. Specific approach, like specifically you have to know nursing audit. This audit is nothing but it is a systematic collection and compiling of the data and process the data, and you compare with the standards and check it whether it is achieved quality or not. Utilization review, like what do you do? Like the patients, how the review the patients when he come, how it was, ongoing procedure, how it is going. Once the patient output is how. So you are reviewing risk management, or like how it's going on. So these are all you have to collect the information. There should be the people research department should be there, and there should be infection control department will be there. The regular research will be there. That's what in there we are told that decision making of the quality assurance is based on the evidence based practice. So how the risk is there, how you reduce it, and then the professional review of the organization, and then the client satisfaction. Every client there should be a form and get his satisfaction. And then malpractice, that means the law and order has to be followed strictly. Either in the pharmacy you have to follow the rules and regulations. So everything, if you are doing a hospital, you are running with the surrogacy 101 law, you have to follow this, or else your faculty members or somebody don't done the misconduct or misbehavior or malpractice or breach of duty, the patient died or something happened, you should follow the legislation and order, get the punishment to the nurses or those who done it, in order to avoid the malpractice. So the malpractice is very bad in a healthcare industry, either the government or the private industry. It is a poisonous. So then you have to maintain this quality. So these are all very much important points. So the quality approach or the assurance approach, the administrator or the hospital wanted to maintain the quality, but it is not translated to the fourth class workers or nurses. They are the one going to implement the quality. So the middle level manager should act as a leader, and the vision and mission has to be translated even to the fourth class workers in the hospital. Then only this hospital can be spread throughout the nations or throughout the world for their quality. Well known or renounced name will be understood by the throughout the world. They can understood for because of the quality, not for this one. So this is very important. And as I told you, nursing audit. What is nursing audit? I told you already. The process of analyzing the data about the nursing process patient outcome to evaluate the effectiveness of nursing intervention. That's a systematic process and collecting the data, analyzing the data in order to check the nursing interventions effectiveness. So how do you do that nursing audit? That is the audit cycle. So they identify the audit topic. For example, what is the audit topic you are going to identify? For example, infection control or MRSA positive, how many cases. So you have to set the standards of this and set the standard and collect the data, how many developed MRSA positive. Because the patient will come with one infection and they go with a double and triple infection. That's very bad, hospital acquired infections. Then analyze it and then implement any protocols A and Y and implement it. So how you are gloving technique, protective techniques, all these things you follow, then you analyze. This evidence-based output can be implemented and reassess, and it is an ongoing process. So how do these do there are different variety of the audit you can do it. That's according to methodology, you can do the retrospective audit, concurrent audit, mixed audit. Retrospective audit, what happened? Somebody developed the bed sore in the hospital. So what you will do is, the patient or developed already, then you can ask, ma'am, already he developed, and what is the thing that you are doing the research with the patient? It's okay. Why he developed, the reason you find out, it will be going to the helpful for bring the new protocol, bring the new rules and regulations, or it will be useful for the further patient. So you will collect the record, find out how often the patient turning has been done, how often they have done the back care, what is the emollients they have used to soothening the skin or something. You can do it. Concurrent is the ongoing audit. Okay, ongoing. It will be regularly you will do the data, collect the data, automatically you will do. Now ChatGPT, AI is there, so data can be processed within a minute. So you can find out. That's concurrent audit also will be helpful for this one. So prospective audit is there. Prospective is the concurrent going on audit. It will be costly. Retrospective will be the cheap, and mixed method also you can do it. According to the agency, it's like an internal audit, external audit. Internal member itself will do some audit. External accreditation body will come and do the audit and give you the accreditation certificates. Correct? According to the system, there is a structure audit, process audit, product audit. So this the question is been always asked in a MSc nursing program, right? So whenever you are writing, you are going to write objectives, principles, process and approach, and the types of nursing audit. Nursing audit alone will be coming as a separate question also. As a MSc nursing students, always you have to talk with some of the models and incorporate and talk about the quality. For that purpose, I gave you some of the models of the quality assurance. First one, it's quality assurance means first you have to know what is the difference between the quality assurance and the quality control. The quality assurance is focused on the process. It's like ongoing, but the quality control will focus on the product output. It's a proactive, it is a reactive. The staff function, it is a line function. It is a line function. Everybody will be line function. And then it prevents the defects. It finds the defects. It's ongoing and parallel. It is a performance after final product. It's a quality audit. It is a testing. Whether it done it or not, like that. Everyone is responsible. Here will be the testing team is responsible. That's a quality control team will be there. If you see the quality assurance in the hospital, quality control will be very limited, but the quality assurance covering the more. So in the healthcare system, most of the place occupied by the quality assurance is the very important thing. Nurses also playing a main role in the quality assurance. Okay, let us see some of the models of the quality assurance. The PDCA model is a very common model. It's a plan, do, check, act. Plan means you are planning criteria, standards, strategies, and do, perform it, and check, and again act, and compare and contrast. It's going on like this. The other model, we will see first the ANA model. ANA model, it's saying about the identify the values, identify the standards and criterias, and the secure the measurement. That means identify it and measure it how you want, and then make it an interpretation. It is according to the measure, it is the below level, low level or high level, and identify the course of action. If it is a low level, Make a course of action, one or two or three, four actions. Why needle stick injury often happening? So you bring another method, recapping or something strictly. You invent something and put it. So burning or any new modalities you find out to dispose the needles or something. Then will be you implement it and again reassess, reevaluate how it is effective. So it is like a cyclic process. It's like a quality assurance is cyclic ongoing process. But you see, this Donapedian is a very nicely explaining. Donapedian, this one. What she is telling is this is about the structure, process, and product she is talking about. So, any quality that the introduction chapter we have seen, right? Like input, process, output, or input, process, and product. Anything you can tell. So, she is talking about the quality assurance means also it should have a structure. The structure in the sense, so identify the structure, standards, criterias, and it also include the infrastructure, demographies, how many nurse patient ratio, education of the staffs, qualification of the staff, they have certificate or not, which technology you are using, cloud technology or what is the technology or computer are you using, the other facilities, how good facilities you are using. The process, the way in which the patient has been diagnosed, patient been treated, how the nursing care been quickly has been given, how availability of the resources are quickly and appropriate resources with the cost effective. And the product output is outcome of criteria like morbidity reduced, mortality reduced, statistics what it says, the healthcare cost and the patient stay will be reduced. Otherwise, they may develop MRSA positive, the length of the stay will be there. Then they healthcare third party payers, if MRSA positive, they will cancel it. The MRSA positive is a mistake of the hospital industry, healthcare industry, why the insurance coverage will not become. So the patient will be arguing and they will go to file the case against the hospital. It's so difficult. So then you find out reduce the needle stick injury, patient fall has been reduced or MRSA positive has been reduced and the drug errors has been reduced or not and patient satisfaction increase or not. So Donapedian is a beautiful model. Many years, many times that been revised, but if you remember only structure, process and product or input, process and product, you put it input, throughput or output, anything you can write, but this is called the Donapedian model. Okay, we are talking about quality. Okay, what is the team members are working under the quality? So the team members of quality assurance are the doctors are there, nurses are there, infection control nurses are there, lab technicians are there, pharmacists are there, physiotherapists are there, fourth class workers also there. So they all are working in this team. Is there any challenges or some issues are there in maintain the quality? Of course, there is a lot of challenges are there. Staff turnover, this is the biggest challenge, and the lack of standardization. Everyone study in a different institution. How to overcome that? If you give a good training and other program, they all come to the straight line, and every of the every unit they should have a policy protocol for each procedure separately. And poor communication of the staff and poor communication of the higher level manager, middle level manager, lower level manager, how the way they translate and communicate it means lot. And ineffective leadership, leader is the person I told you influence each other, and if he is not an effective enthusiastic leader, and the subordinates will be lack of enthusiasm, then lack of experience, lack of training, and then compliance. How to overcome? The strategies to overcome. Organize the in-service education on and off. Give good orientation and training program. Every time your contract will be renewable only if you go for the CPR courses or the drug calculations courses. You conduct some routine courses, and there you make one education team. Every month they have to attend or 1 or 2 in-service education. That should be a protocol. According to this, you can give the incentives. Constant motivation you have to give them. Good performing staffs, they have to give an incentives and rewards. Certificates has to be given to them, and standardized performance appraisal has to be made without any partiality. And then good orientation training program, mentoring will be good, and good remuneration, and the good facilities for the staff, quarters and other facilities, and maternal benefit. HR should be a good communicate to the staff what all the benefits are there. layoff benefit, whatever the benefits you give it, then the staff turnover will be there, will be reduced, then the quality will be good. So today's class we have seen a cup of coffee with the introduction, and we have seen about the what is the definition, objectives, principles, process, approaches, and nursing audit in quality assurance, and different models of the quality assurance and the quality assurance team, and what are all the issues in maintaining the quality assurance, and what are all the strategies and challenges to overcome. Hope you understand. Thank you.